Good.
Hi, my name is Alyssa, and I'm a nursing student at NEURO. Is it okay if I do a musculoskeletal and neurological assessment on you today?
Yes.
Alright, so upon just looking at you, you look like you're dressed for the weather, you look nice and put together, and your speech seems normal, which is good. I'm first just going to start with immediate recall. So I'm going to tell you 5 numbers if you could just say them back to me after I'm finished. So 3, 7, 6, 2, 1.
3, 7, 6, 2.
Great job. And then I'm going to do recent memory. So I'm going to hand you 3 objects. If you can just tell me what they are.
Mask, nail polish, and remote.
All right, so I'm going to put these out of your view, and then I'm going to ask you what these 3 objects were later, okay?
Okay.
Okay, so next I'm going to do your remote memory. So what's your mom's maiden name?
Ocean.
Perfect. All right, so I'm just going to go through a thought process scenario with you. So if you were walking in the mall and somebody in front of you dropped their wallet, what would you do?
Pick it up and get to it.
All right, that's a great appropriate response. So upon already looking at you again, your emotional status seems normal. You're not crying or being overly laughy or anything, which is great. Next, I'm just going to ask you about your activities of daily life. So can you sit by yourself and stand by yourself, walk?
Yes.
Can you feed yourself, bathe yourself, brush your teeth, brush your hair? All right, perfect. So next, I am just going to inspect one of your joints. So if I can see your wrist. All right, any tenderness there?
No.
All right, so upon looking at your wrist, I didn't see any atrophy, contractures, bony enlargements, redness, nodules, and swelling, and you don't have any tenderness, which is great. So next I'm just gonna check your olfactory nerve. So if you could just close one nostril for me and breathe in. Other side. That's good. And then I'm just gonna grab this candle over here, and if you can tell me what it smells like.
Good.
Is there a specific smell?
Just the ocean.
Okay, that's good. Alright, so next I'm going to check your optics. So we've already done this, or we would do it again, but for acuity we would use a Snellen eye chart to see how many letters you got correct. And then for your visual fields, we would check your 6 points. Yeah. So next I'm going to check your oculomotor, your trochlear, and your abducens. So if you could put a bridge up on your nose, usually I would have a pen light, and I would shine it in this eye, make sure that your eye contracted, and shine it in this eye, make sure that it contracted, and that would be direct. And then to check consensual, I would shine a light in this eye and make sure this pupil contracted, and then the other way around. So that's good as well. And then I'm going to check accommodation. So just look at my finger. All right, and your eyes converged and accommodated to my finger, so that is great as well. So now I'm going to do your 6 points of gaze and check for nystagmus. So just follow my finger. Sorry, I'm moving a little fast. All right, so no nystagmus nose there, which is great. So next I'm going to check your trigeminal. So if you could just clench your jaw for me. And I would try to open your lip, but I don't want to come too close. So your temporal and masseter muscles are strong, which is good. So next I'm going to check your sensory branch. So I am going to touch you with this, and this will be light touch. And I'm going to check you with this, and it'll be pain. So if you could close your eyes for me, I'm going to check your face. And if you could just tell me if it's light touch or pain.
Okay. Light touch. Light touch. Pain. Pain. Light touch. Light touch. Pain. Light touch. Pain. Light touch. Pain. Pain.
All right, that's great. Everything looks good there. So next I'm going to look at your corneal reflex. I'm not actually going to check that, but what would happen is I would get a cotton ball and move it close to your eyes and see if you would blink. So hopefully you would blink. And next I'm going to check your facial nerve for symmetrical moves. So if you could raise your eyebrows, smile for me. Great job. Frown. All right. So your facial movements are symmetrical. So next, I'm just going to check your muscle strength. So if you could pull up your cheeks for me like this. Good. And then if you could stick your tongue on your cheek. All right, your muscle strength there is good too. So next I would check your acoustic nerves. So I would do a whisper test, a Renee test, and a Weber test. Next I'm going to check your glossopharyngeal and your vagus. So if you could swallow. All right, that looks symmetrical. If you could stick out your tongue and say, ah. All right, your uvula movements are symmetrical. And then if you could, I would check your gag reflex, but I don't want to make you gag today, so we're not going to do that. And then upon just listening to you, your voice doesn't sound hoarse or anything, which is great. So next I'm going to check your spinal. So if you could just shrug your shoulders for me. All right, look left and right. All right, and then shrug your shoulders. All right, so your trapezius is strong, and then look that way and try to look this way. Oh, that's good too. Other way. Perfect. So your sternocleidomastoid and your trapezius muscles are strong as well, which is great. So next I'm going to check your hypoglossal. So if you could just stick out your tongue. All right, I don't see any tremors there. And then if you can move your tongue up and down. Yeah, side to side. All right, that's great as well. So next I'm going to check your motor cerebellar. So point to point testing. So if you could just put your arms out like this, touch your nose. Great. Close your eyes. Put your arms back out. Don't hit the wall. There you go. And put them back on your nose. Perfect. Okay, so next we're going to do your rapid rhythmic alternating movements. So if you can pat your leg. All right, if you could do fingers to thumb. Great job. And then if you can flip your hands. Great job. And tap your toes. Perfect. Next, we're going to do your motor non-cerebellar. So if you could just grip my fingers for me. Perfect. Seems even and strong. If you could do your Romberg. So we're going to stand up. All right, close your eyes for 20 seconds. I'm going to check to see if you sway or anything. Perfect. I didn't see any swaying movements, so that's good as well. So keep standing. If you can walk this way, your gait seems normal. You don't walk with a limp or anything abnormal. And then here, if you want to come back in front of your chair, and then if you could walk on your heel to heel like this. Perfect. Everything seems normal there. And then if you could walk on just your heels. Perfect. And then just your toes. Perfect. And then if you could hop on one foot. Great. Other foot. Great job. Okay, so next I'm going to check your spine. So if you could just bend over. I don't feel any deviations or any abnormalities there, which is good. If you could bend front and back, side to side, twist. All right, so you have good range of motion. You can take a seat again for me. If you can hold out your arms, I'm gonna try to resist my pushing. Good strength there, and then if you could hold up your legs, try to resist. Great job, good strength there as well. So next I'm gonna check your sensory system. So I'm gonna do the same thing with light touch and pain. So just close your eyes and tell me which one you feel.
Pain. Pain. Light touch. Pain. Light touch. Light touch. Light touch. Pain. Light touch. Light touch. Pain. Light touch. Pain. Light touch.
All right, I'm gonna check your legs. If you move your hands.
Pain. Pain. Light touch. Light touch. Light touch. Pain. 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 Light touch. Pain. Light touch. Light touch.
All right, that was good. So I didn't see any abnormalities there. So next I'm going to check your vibrations in your fingers and toes. So usually I would have a tuning fork. I would strike it on my hand, and I would place it on your fingers, and you would say if you felt the vibrations or not. And if you feel vibrations, that's normal, and I would do the same thing, and I would strike it on my hand and put it on the most distal joint on your toe and see if you felt vibrations. So next I'm going to check discrimination. So the first one is stereognosis. So if you want to close your eyes, I'm going to hand you 2 objects, and if you can just tell me what they are. Before we do that, I'm sorry. What were the 3 objects I asked you to remember at the beginning of the assessment?
A mask, a nail polish, and a remote.
Perfect. Okay, so close your eyes. I'm going to hand you 2 objects. Let me know if you know what it is.
Nail polish.
Yep.
Remote.
Perfect. So that, your stereognosis is good. So next I'm going to test your grypthesia. So I'm going to draw a number on the palm of your hand, and you're going to tell me what it is, okay? You don't know?
No,
Okay.
do this hand. 4.
Okay.
8. 9.
Perfect. Okay. So next we're going to do point localization. So I'm just going to touch you, and you're just going to touch the exact same spot I touched.
Okay.
Perfect. Okay. So next we're just going to check your reflex functions. So we're going to start with your bicep, and usually I would have the little thing. So you just rest all of your weight in my hand, and I would tap you right behind your elbow, and we would see a little bit of a movement. And then I would check your tricep. So I'd smack you right here, see a little flex in your hand. Next, I would check your plantar. So we are going right below your knee, and you would kick like that. And then check your Achilles. So I would hold your foot and tap right here, and we'd see your foot. And then I said plantar, this is patellar. Sorry about that. But your plantar, I'm just going to go towards the outside of your toes and around, and normally you would see the toes curl. But that completes my assessment for today. Is there anything else I can help you with? All right, thank you.
Okay, here we go. Hi, my name is Giana. I'm going to be your student nurse today. We're gonna be doing some neuro tests. So I'm just going to be looking at your different cranial nerves, your senses, your smell, and then I'm also going to be looking at some of your reflexes today. Can I have your name and your date of birth?
Kylie Volks, 3/21/2003.
Awesome. And then do you know where you are?
The Kappa House,
And then do you know the day of the week?
Thursday.
Awesome. So patient is alert, patient is responsive, she knows where she is, and she's able to identify the day of the week. Her skin is pale, obviously very alert. So we're gonna get started. First we're gonna do your cranial nerves. We're gonna start with that first, and then we'll end with your reflexes. So I'm gonna start. Have you had any change of smell in the past couple days or the past couple weeks?
No.
No, okay. So her patient's olfactory nerve is intact, as she does not have any change in smell. And then have you had any head injuries, any headaches, any concussions?
No.
Okay. Patient has not presented any cranial issues before, so we're gonna continue. So we're gonna go to your optic nerve now. So that's your cranial nerve number 2. So normally we would do a Snellinger test, which you would be 20 feet away from a piece of paper that has a whole bunch of different letters on it, goes big to small, and then you would read, you'd cover one eye, read as far as you can go, cover the other eye, read again, both eyes, read as far as you can. And if you were above 20/30, I would recommend you for an ophthalmologist or an optometrist, but we don't have that right here, so we are just going to continue. And then, oh my goodness, so we're gonna test your near vision, and I'm gonna give you this little chapstick, And if you could read the flavor for me.
Berry.
Awesome. Thank you so much. So the patient's near vision is intact because she is able to read the flavor of the chapstick and identify correctly. So now we're gonna move on to your octomotor senses. So your cranial nerve 3. So that's gonna be your eyes. I am gonna be shining a light as an FYI. So it is kind of bright. I'm gonna give you a warning as to when I do it. But I'm gonna do 2 in one side, 2 in the other. So just stare off in the distance. You don't have to stare at me. And I'm gonna start. So it's coming in. Oop, just kidding. I need to look at your pupil size. So pupil size is a 5, I would say. Now I'm gonna begin. Okay. Awesome. Blink a little bit. You good?
Yep.
Okay. We're gonna do the other side. Awesome. And then if you could follow this pen for me with your eyes, not your head, just your eyes. Okay. Awesome, thank you. So patient's cranial nerves 3, 4, and 6 are all intact. We know this because her pupils are reactive to the light, they're equal, and they're round, so they're perlas. And she can also follow the pen with only her eyes. Now we're gonna move to your face. So it's cranial nerve 7. And I would rewash my hands because I am touching your face, but for now I'm just gonna ask you to relax your face. I'm gonna touch it. I'm gonna tell you to clench, and then release. And I'm just checking for some symmetry and just to see your strength level. So clench for me. All right, release. Thank you. And then I'm gonna use your pencil. And this side is gonna be, this side, I'm just gonna touch your face in 3 separate points. So keep your eyes open for me. Do you feel that?
Mm-hmm.
That?
Mm-hmm.
That? Awesome. Now you're gonna close your eyes and you're gonna tell me if you feel everything.
Mm-hmm. 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 Mm-hmm.
Awesome, thank you. So her cranial nerve 5 is intact because she can feel the different senses on her face, and then when she clenches, there is symmetry. So now we're gonna move on to 7, I think, 7, which is your cranial nerve 7. So I'm gonna be looking in your mouth. We don't have a tongue depressor, but for all intents and purposes, I'm just gonna look in and use my light and just try to press your tongue down on the bottom of your mouth as hard as you can. Okay. Let me say ah. Okay, thank you. So I could actually see her uvula without the tongue depressor, which is really awesome. So good for you. I could see her uvula, but that is intact because I could see her uvula vibrate, and then I could see her tonsils in the back vibrate as she was saying ah. So that's good. And then we're gonna do your I'm gonna assess the strength of your neck and your shoulders. So I'm gonna put my hand on your face again. I would rewash. And then so I'm gonna put my hand right here and press against it to try to turn your head. Awesome. And on the other side. Awesome. And then try to push against my hands. Perfect. I'm sorry, my hands are so cold. Okay, so her muscles are intact. I would give her a 5 on the muscular scale because she can resist and move. And now we're gonna go back, and I'm gonna put your feet up here for me. And could you just like put your heels down, like your feet like that? Like
Oh.
You know what I mean? Like
Yeah,
you're
yeah.
getting a pet here.
I
And
don't follow directions.
I am going to assess her plantar reflex. So I'm just gonna take the back of this pencil and we're gonna go up and around. Okay, her left side is negative and her right side is also negative. I did retest twice because it did come back negative, but I'm not seeing any plantar reflexes going on. And then I'm just gonna keep your legs there and I'm gonna test your senses. So again, I have a pencil. I'm gonna have you put your arms right next to you, and this side is sharp and this side is dull. So I'm gonna go on both of your arms and then both of your legs and just tell me if you feel a sharp or a dull pinch, okay? Close your eyes for me.
Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. 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 Sharp.
Okay, so there are a few discrepancies. It's okay. There are a couple discrepancies. There were on the left arm and the right arm a couple mistakes between sharp and dull. So on the legs, patient is able to identify between sharp and dull. On the arms, she's moderately able to distinguish between sharp and dull. And then I'm gonna have you put your feet back on the ground again. And I'm gonna use the head of my stethoscope and I'm gonna test your reflexes. So if you could back up on the scooch, there you go. Okay. So I'm palpating, and then there's just gonna be I gotta move over. There's gonna be a slight flick. Whoa! Okay, so her patella reflexes, I would give a 1. They are weak, but they are there. They are there. So that's good. And then I'm gonna have you stand up for me. And then you are just going to back up a little bit. And then you're just gonna walk, and I'm gonna watch you as you walk. Go ahead. Okay, and then turn around. Okay, so patient's walking is symmetrical. Both of her arms are moving opposite sides, and she is balanced. So I'm gonna have you stand with both your feet together and close your eyes for 20 seconds. Okay, 20 seconds is up. Patient wasn't swaying, so her balance is still very good. And then I'm gonna have you stand on one foot and jump 3 times for me. Other side. Okay, awesome. And then you can have a seat.
Okay.
So patient is able to stand on one foot and jump. Again, she's able to maintain her balance in that. Lastly, I'm gonna have you turn around and then cover one ear. And I'm gonna step back and I'm gonna whisper a word.
Oh, God.
And then you're gonna guess which word, or you're gonna tell me which word I'm saying.
Okay.
Okay, ready? I can say it again.
Candle?
No. Let's try the other side. I'm gonna use a different word.
Dog?
Yes. Okay. So, patient has a little bit of trouble hearing on her right side.
My left ear.
On her left side. But nothing that can't be fixed, obviously. But yeah. Do you have any questions or concerns?
No.
Do you need any help with anything before I leave?
No.
Okay, thank you.